Hello, thanks for having me here today. Come over from Perth. As has been mentioned, I'm going to talk to you today about some work that we've been doing as health researchers to how can we try and get our research actually into planning policy and practice. How can we actually have a benefit? So I don't know what the mix of people here in the room, whether we're researchers or practitioners, so I am academic, and hopefully you'll see today that we're trying to move beyond the traditional academic role in our silos and see actually how we can get our work to actually have some impact. So, as has been talked about, there's established links between, I think we all know that we're here, between the built environment and creating supportive environments for walking and cycling behaviour. I'm not going to dwell on that, okay? And I think we know what many of those design features are. But despite this, we are still building some environments, especially on our fringe areas, that quite frankly are still suboptimal for walking and cycling behaviours. Especially in Perth, you know, we have suburban sprawling, predominantly residential development that still is predominant. And it's not good for walking and cycling, and indices of suburban sprawl have been associated with decreased levels of walking, cycling, increased levels of obesity, and increased sitting time in cars. So how, as public health researchers then, if we know that there's evidence out there for what we should be doing for our built environments that are supportive for walking and cycling, how can we get this into practice? And there's been an increased focus on how, as public health and active living researchers, how we can actually disseminate and translate our research into the sectors that are actually responsible for creating the built environments in which we live. And there's been a lot of rhetoric around this, how, as academics and researchers, we should do this. But I'm going to take you through today some of the stuff that we've done and has actually had a positive influence on a planning policy over in Perth. So we've talked about, we've got evidence and we need evidence, and urban planners need evidence, but what types of evidence do they need? There's vast summaries of evidence out there, journals from public health researchers, summaries. Heart Foundation have many documents, Healthy Active by Design, which are fantastic advocacy documents advocating for supportive built environments for walking and cycling to the planning departments and sectors. But are we actually producing the right types of evidence to actually influence what they do? Now, in the academic field, there's a lot of talk around, oh, we need more longitudinal evidence so that we can actually establish these kind of causal relationships between our built environments and our health. But actually, is that what practitioners and policy makers need? And if we look at the adage of a public health professor here, if as health researchers we actually want evidence-based planning, urban policies and practices, well, first of all, we need to provide them with policy and practice-based evidence. And there's recently been a review undertaken by Steve Allender here in Australia, and they interviewed a number of planning professionals and policymakers to actually find out, well, what kind of research and evidence do you need? And the thing they came back with was, well, don't tell us what we already know. Okay, don't tell us just more of general measures of the built environment and what is or isn't supportive for walking and cycling. The evidence that we're producing needs to be linked to policy, regulation or legislation. They've indicated that we need to be looking at the impact of existing planning policies on health. Let's look at how much of planning policies are actually being implemented and how they're impacting on health. And so can we actually demonstrate the effectiveness of current planning policies on health to actually give them some feedback? And interestingly, this is a criticism. If we look within the planning academic literature, the criticism of their field themselves, that they're saying that much of their research in the area of what they constitute to be successful planning outcomes, well, they actually just assume that implementation of their planning policy has occurred. They don't actually attempt to determine how much of the policy has been put in place in the first place, and therefore to work out the positive effects that that might have on planning activity. And so this is important, this assessment of planning policy implementation, because if without a rigorous evaluation of how much of a policy has actually been implemented on the ground, how can we actually judge whether a policy is having a positive impact on its intended outcomes, on the walking and cycling health outcomes, or whether if we're failing to implement the policy. So we have this question of policy principle or policy practice. Where's the problem? It's also important that we need to be politically aware and understanding when is the evidence needed. Okay, so many things that many public health researchers haven't done and that we're starting to realise now is we actually really need to understand the planning system and the political system and the planning world and political system in which we're trying to influence. We come from outside of that sector. So we need to understand theories of policy development and policy cycle, and then whereabouts in that policy cycle can we intervene? What level of the planning policy is it best for us to intervene at? Is it at federal, is it state, or is it at local government? And this might relate to the types of evidence that we have. Different types of evidence might be needed and are likely to be needed at different stages in the policy cycle. And also, that's why it's important if we're looking at any planning policies to actually know at what stage in this cycle any planning policy is that we're evaluating so that we can tailor our advice and our feedback accordingly. And we have over at UWA in the Centre for the Built Environment and Health where I work, we have an advisory group which is made up of members from the Department of Planning, Transport, Planning Institute of Australia, practitioners. And one thing that I've constantly been challenged by those is, okay, well, which policy do you want to influence? And what's the actual intervention point in that policy? What bit of what policy do you want changed and why? And how do you want it changed? How should it be different to what it is now? So really challenging us to provide pointed and direct evidence and feedback to the people that we're actually trying to influence. So a bit of a background there in some of the things that we've started to try and think about in terms of setting up our research and thinking at the very beginning what we're going to do with the findings and how we might disseminate it so that we don't just get to the end and we've got these results and go, what are we going to do with them? So I'm going to talk you through now a case study of the residential environments or reside project that we've had running over in Perth now for over 10 years. So Perth is not known, has not been known for its inner city living, and is actually home to one of the world's largest urban sprawls. The metropolitan area actually spreads some 170 kilometres from the north to the south and covers well over 100,000 hectares. And the dominant mode of planning and developing, especially in our greenfield areas and on our suburban fringes, has really been low density suburban sprawl developments. And some stats from the Department of Infrastructure and Transport a couple of years ago, Perth actually had the lowest proportion of people that walk to work and cycle to work out of all the capital cities in Australia. So clearly some room for improvement over there in Perth. Now, what actually happened is kind of a window of opportunity opened up back in 1998. So if we're looking at a kind of a theory here, Kingdon's theory of policy, we had a problem stream. So the problem of unsustainable suburban sprawl was actually recognised and perceived as being a pressing importance for Perth. Not necessarily from a health outcome, but from a sustainability, a climate change, much of the same problems that were recognised by the mayor here. So this was being identified. And what then happened, there was a new proposal put forward for a new policy that was going to replace the conventional development control policies that were over there in Perth and were thought to be kind of exacerbating and leading to the suburban sprawl. So a new policy was put forward, and the political environment at the time, there was great political support, a good climate and mood, both from the state government, the Department of Planning, the Western Australian Planning Commission, and also community awareness and support for a change in how we build our suburbs. And all this led to this kind of this window of opportunity for a new policy and the establishment of the Livable Neighbourhoods guidelines, which then went through and has been a major part of the Western Australian Planning Commission and the Department of Planning's agenda over the last 10 years. So a bit of background on the Livable Neighbourhoods. So it was introduced back in 1998, as I said, by the WAPC. And it's actually a local interpretation of new urbanism development. And in there it clearly states that its aims are to reduce sprawl and facilitate the development of more sustainable suburban communities on our fringes. And it can actually be applied to both the greenfield areas, but also to kind of brownfield infill areas as well. And it clearly states, as one of its principal aims in the policy, that it aims to encourage active forms of transport, including walking and cycling and public transport use. So a new policy introduced over there in Perth. Now, it actually had at the time, it's undergone a couple of different reiterations, but there were 4 key design elements to this: community design, movement network, lot layout and public parkland, which actually set out the design intent and a number of policy requirements for how we could better be designing the neighbourhoods in Perth. Okay? Under each of these there was a large number of different both quantitative and qualitative statements about how we should be designing the neighbourhoods. Now, in terms of the timing of the implementation of the policy and the project that I'm going to tell you about that we set up in the policy cycle, the first edition had been introduced. That was this new policy instrument. It had undergone extensive public consultation and coordination to the point where the Planning Commission made a decision. We're going to adopt this as our preferred policy for the assessment and approvals of all new planning applications in Perth. At the time, a second edition, after the first edition and all this review, a second edition was introduced, and we found ourselves in this implementation stage in about 2002. And at the time, it was actually still a voluntary policy. So remember that when we talk about some of the results in a minute. At the time, it was a trial. So developers or anyone a planner putting an application had the choice. I can put my application in under the Livable Neighbourhoods policy, or I can use the existing conventional planning policies that were there. So we're in this implementation stage, and Amy and I, who's up next, we're actually only talking this morning, everybody had an opinion on Livable Neighbourhoods. It was a hot topic. People hated it, people loved it, a lot of rhetoric and a lot of debate around this. And despite, in his foreword of the policy, the then planning minister actually saying that being able to measure and monitor the on-ground implementation of this policy would further refine it. Actually, no evaluation had taken place, and none was actually looking like it was planned. So a big gap here in terms of being able to answer some of these questions around this policy that were being so hotly debated over in Perth. So the introduction of this policy provided a unique opportunity, a natural experiment for us actually to say, okay, well, we'll do some evaluation on that. So Professor Billy Giles Cortai, who many of you may or may not know, 10 years ago led the establishment of the Reside project, where we said, well, we're going to actually evaluate the impact of this new planning policy on residents' walking and cycling behaviours, their public transport use, and a whole range of health outcomes. So what did we do? Well, we got about 2,000 people, and we surveyed them in their old homes, all over Perth. Surveyed them in their old homes. And then we've since surveyed them over the last 10 years, 3 more times since they've moved out into a new house in one of these new residential developments, some of which were designed and given approval under the Livable Neighbourhoods policy, some under the old policies. So we could do some comparisons there. So these people were surveyed, like I say, 4 times over 10 years on their walking behaviours, their cycling behaviours, and a whole range of health outcomes. But one thing, what we also wanted to do, we've mentioned what types of evidence do we actually need and are actually going to impact. So as part of the evaluation, we actually also carried out an extensive process evaluation where we wanted to answer some of the questions around, well, and actually answer this debate. Is it policy principle or is it policy practice? In principle, is this policy having the desired impact on the walking and cycling levels of the residents? So we wanted to know, well, had the plan and the policy actually been followed? Was it being implemented on the ground? And if so, are its effects desirable, positive, as expected or anticipated? So with that in mind, we set out with a number of aims, and this is actually what formed the basis of my PhD for 4 years. I said, well, come on then, let's actually measure how much of the policy's actually been put into practice on the ground in the housing estates. And we looked at all of the results I'll show you is based on 36 housing developments, which we've measured. And I said, well then, let's actually see if we can quantify the degree to which what's actually been done on the ground actually reflects what was actually intended or envisaged by the policy in the first place. So we can start to see what is or isn't being done and how that may be or maybe not impacting on the health outcomes of the residents. So the methods. I did a review of the document, and if anyone is familiar with the Livable Neighbourhoods, it was quite a long document. There was across the 4 elements, about 130 different design requirements and features, which all the developers had to go through and go, well, what bits should I be doing? So we went through and I've said, okay, well, which of those are actually saying they're actually a design feature that we want you to do and that we can measure? So we've identified those. There was about 60 of those. Then in geographic information software, the mapping software, I've developed measures that were specific to each of those requirements. And I've gone and actually measured the on-ground implementation of each of those requirements in each development. Then let's see if we can quantify the levels of compliance with each element and overall. In terms of the methods, I got a bit carried away with this, why my PhD took me 4.5 years to complete. In the end, my supervisor had to say stop. But, so we've gone from the community design element, okay, what can we measure? Well, we've wanted to look at where there are neighbourhood town centres. Let's look at the walking distance of those, the diversity of the destinations within those, the configuration and the format of those, access to public transport, the number of routes and services daily, the movement network. Okay, let's look at the street connectivity, the block sizes. Love a good cul-de-sac. Let's have a look at the cul-de-sac. Okay, here's an example. The policy says that if you have a cul-de-sac, it should be no more than 120 metres in length. Each cul-de-sac should have no more than 20 residential lots on it. That's what I went and measured. And we can say yes or no, is it meeting this? We looked at the footpath network. There wasn't a footpath layer, so we hand digitised 1,500 kilometres of footpath network in all of the estates. We didn't have a tree layer, so I actually hand digitised 21,742 tree canopies and had RSI at the end. So I told you I was thorough. So we wanted to look at the streetscapes, we're looking at the cycling networks, we're looking at the lot layout, the residential densities, the housing diversity and choice that's there, both development-wide and then within the catchments of the public transport centres and the neighbourhood centres, because obviously the density is important to support these services and make them viable. And we looked at the public parkland, the amount of public parkland, its location, its access, what was in it, and the kind of a safety aspect, which LN focuses on. Let's look at the frontage and surveillance to that. So a whole suite of measures for all of these developments. We've got completely carried away. So then we've said, well, we need to make some sense of this. So we've taken those, and at each of the measures, we can look against what the policy asks for. So we can look at each element individually and say, well, how well did that development comply with each element? And then we can also add it up across all of the elements and get a kind of overall policy compliance. Now, a caveat here, obviously, LN, we've looked at it kind of like objectively. We're quite aware that, you know, LN is actually meant to be a performance-based code and things aren't always as black and white as numbers like this, but we have to start somewhere, and clearly some of the evidence earlier said that this is actually an important place to start so we can actually see what is or isn't being done. So, the question then was, well, actually, how well had the policy been implemented in the housing estates? And actually, the Department of Planning were quite keen on this answer and were quite shocked when we were actually able to show them that actually, you can see here, we're only about 50% on average of the actual policy was being implemented. Now, we've done a whole qualitative review around this as well. Now we know what is and isn't being done, we can actually start to ask questions for the reasons why these things aren't or aren't being done, which has been fantastic with the Department of Planning, but at least we were actually able to tell them what they were or weren't doing. Okay, so, and actually the overall score was, I think, about 53%. So, we're clearly showing here that perhaps implementation of the policy isn't being put into practice on the ground as was intended. But the question then remains, well, was more, if you actually did the policy and actually put it into practice on the ground, did it actually have positive impacts on the health and well-being outcomes of the residents? So we started, first of all, my PhD focused on looking at the walking behaviours, but since then we've actually looked at mental health, sense of community, and some measures of safety from incidents and being victims of crime in these estates. We've got 4 different health outcomes here. And what we found, for every 10% more of the policy that they put into practice on the ground, actually people were 53% more likely to be walking within and around their neighbourhoods and for transport. Okay? Actually, there was increased levels of sense of community amongst the residents. It improved mental health, and there's real big links here between sense of community and mental health and isolation and things in the suburbs. So we saw that they were walking more, a better sense of community, better mental health, and this is actually a good thing. People were less likely to report problems with crime and safety in their area. So we actually see that, okay, perhaps there's some positive outcomes here if we're actually doing this policy. And if we break it out by the different elements, you can see the results, and what clearly comes through is the importance of this community design element, which talks about all the social infrastructure, things like neighbourhood centres, the provision of the public transport. So having these infrastructure in these developments, which are often the last things to go in many of these developments and lacking, are very, very important. So we were then able to answer this question, is it policy, principle, or practice? And the results seem to show, we were able to present on many occasions and work with the Department of Planning that, well, in principle, it would appear that your policy is correct and can have some positive impacts, but actually, clearly, you've got some serious problems around your policy implementation that need to be addressed. So I spoke earlier about this kind of window of opportunity that came about with the Livable Neighbourhoods policy actually coming into effect in the first instance. Well, back in around 2013, this second window of opportunity came about. It was actually the 10-year anniversary of our Reside project and 15 years since LN had been introduced. And the Department of Planning announced a review of the Livable Neighbourhoods project. So this window of opportunity came up where we'd done some work on the implementation and evaluation. It started to help them identify some of the issues, and the policy was up for review again. And we had made massive attempts and efforts over the 10-year period of the project to really engage with the Department of Planning. They were involved in the setting up and the design of it. We were often in there regularly trying to present the results to them. And actually it was finally these results around the implementation that really grabbed their attention and engaged them with us. And they came to us. It was fortunate as well that the actual lead of the Livable Neighbourhoods review team got it and was really interested in the evidence as well. So it's really good to have that support person in there. And they really wanted an evidence-informed review of the policy and were really interested, therefore, in the findings from the Reside project and how we could help them. So they put out a number of discussion papers, okay, with a number of questions asking, well, what had worked, what could be improved, what hasn't worked, what was missing, and are there any kind of non-negotiable things that should be done? And we put together a couple of discussion papers, responses back to them, really built around the evidence, the results that we'd used. But then they came to us and they said, well, actually, what were the most important design features for health? Which one of all of them from the policy, actually, where should our focus be? Are there some that we really should be advocating for and pushing within the Planning Commission as really focusing on that are really important for the walking and cycling? So this was, a fantastic opportunity. They're coming and engaging with us. So we set about to see if we could answer that question for them. So we said, right, well, of all of the design requirements from each element, can we identify what were the ones that were most strongly associated with these different health and wellbeing outcomes? Okay, so we did some fancy stats, which even I don't, is some fancy stats to say, yep, can we do this? And tested it against a number of different health outcomes. So first of all, we started with the walking, and we found that what came out from across the different requirements were 13 different design features, okay? In terms of having, obviously, a neighbourhood centre, but actually how you design that neighbourhood centre was important. So something could be a big box centre dominated by car parking was okay, but actually if you designed it as a main street centre, walkable, cycling, friendly environments, it was much better. You're 5.5 times more likely to walk to it. And we identified this subsection of these 13 design requirements from across the 4 elements. Then we said, well, are they actually also then important for those other 4 outcomes? And we're able to say that, again, we can see having a centre is important for your safety and your mental health. And many of these same design requirements were also supportive across the other health outcomes. But we didn't stop there. So the Reside project had gone, as I said, for 10 years. There was vast amounts of evidence, not just from my PhD. So we wanted, and the Department of Planning challenged us. They said, well, it's not just walkable neighbourhoods, it's livable neighbourhoods. Okay? And even though we'd started to look at some of the other health outcomes, it was more than that. And so across Reside, we'd actually looked at 13 different health outcomes, numerous researchers and PhD students. So what I said about doing, I said, well, we took results from 38 papers. It's like nearly 400 different analyses, which I've gone through, and we've said, well, how do those health outcomes, do they map positively onto those same design features for health? And we've gone about summarising that to say, okay, we can come up with a short list. It was of 15 design requirements, which I'm going to come back to in a second to show you what the Department of Planning have been done with that. So we've really tried to provide the Department of Planning with a real evidence-informed view of their policy. So what are the next steps? Well, as I mentioned, the Livable Neighbourhoods was under review. It's still under review after about 3 years. But late last year, they did actually release for public comment, edition 5. So this has been out for public comment, a draft. It's now back in, and they're dealing with the fallout and everybody's opinions and comments from that. But we've maintained relationship with the Department of Planning and are engaged with that. Now, I mentioned that we saw that implementation was the problem with the policy. And what we kind of do is we've been working with the Department of Planning to say, well, can we identify where the problem is in? And we've kind of got this analogy, if you like, of this leaky pipe. And so there's a whole system from, we've got the policy, a plan, an application is developed, for example, by a developer. It goes to the local government authority for them to do their report on it before going to the Department of Planning for approval and then out for construction. Okay? But where in that system might there be a leak that's affecting from the policy intentions here to actually what we're seeing on the ground? Okay, so if we're seeing like low levels of compliance at this first stage, is it a problem with the industry acceptance and uptake of this policy? I don't think it is. Once it goes into the local government, what changes are they making and how does that differ by local government? Many of the design features and requirements within the policy are at odds with many of the local government planning schemes and engineering standards. So there's this kind of disconnect here. So where's the leakage in the policy here from what's not getting through? And then Department of Planning themselves, their own in-house, well, what are they actually approving? How much of their own policy are they upholding or approving? And they're first to admit that actually they don't have any consistent and rigorous approvals approaches. So one stat planner over here can assess it one way and let things through, whereas the other team might let it through differently. And then once it's been approved, who's actually enforcing what's actually implemented back on the ground? And often we can see there's a gap here. So it's important for us to say, well, where is the leak in this system so that we can kind of plug this implementation gap if we take the results that we think, in principle, this policy is worthwhile and beneficial to do. So the Department of Planning, working with them, they've realised, what can we do to plug the gap in our own in-house? Okay? Now, what they've been wanting to do is, I mentioned we came up with a list of kind of these 15 evidence-informed KPIs for health. Okay, here they are. We've worked with them, and now what they want to do is, all new plans coming in, they want to be able to do some kind of monitoring and performance against these. Now, these aren't going to be used as the be-all and end-all assessment criteria, because if they start doing that, they're worried then that's all the developers will concentrate on, and the policy is obviously more than just these 15. There was also some resistance in the Department of Planning about, well, why are we only doing health-based indicators? Luckily, the lead of the LN review, who's been very much engaged with us, has seen, well, if it's good for health, it's good for walking, it's good for cycling, it's good and ticks the box off on many of the other agendas that we're trying to bring about in the Department of Planning. And also, they want to use it as a bit of a proof of concept that we can actually do some monitoring and evaluation and some evidence-informed kind of decisions around our policies. So we've worked these up, and we've worked with some of the senior planners in the Department of Planning to say, well, how can we develop up some methods for actually assessing these on plans that come in which are actually kind of feasible and amenable to the planners without giving them any more work to do. And what it actually means then is they're going to start to plug this gap as well. Well, can we get our own in-house sorted and our own consistent approvals? And so these methods are going to be hopefully used to come up with a consistent approvals process within there. Now, obviously in time, the number of indicators that we might look at could increase, okay? But the goal will be to do this. And of course, we can then start to see here, well, what is or isn't being approved, and in time, it might be able to be a feedback system, feedback loop into the system, whereas, well, if you're not matching these to the required level, back it goes, and we're not going to approve it. So in time, hopefully, there can actually be a proper stopgap to this leakage through the system. So, talking with them though, if you want to be able to assess and monitor how well your policy is doing, well, you actually need a benchmark of current practice. So we persuaded them to actually do an assessment of all of their current applications that they had in the Department of Planning against these criteria. So we've actually, and it was a good test case for how feasible it was to do it, we've looked at those 15 criteria and assessed them on 40 different applications that are currently sitting within the planning of department. And I literally only got the results before I got on the plane on Friday. But as an example of, you can see the type of thing we can do. So this is looking at the policy requirement is that 60% of the residential zone should be within 400 metres of a neighbourhood or town centre in a new development. So here's 20 structure plans and 20 subdivisions, and we can actually see, well, how well is that target being met? Okay? And actually, at the minute, the average is only 32% of all of the residential zone being within. So this is an example of how we're going to be able to look at the current performance of what's being put in and feed that back to the Department of Planning. And obviously now we know our benchmark, so that when the new policy is released and they get their own in-house assessments, and year on year, can we see an increase in that? Can we actually get close to the target? So, as I said, we've just received the results now, and actually we've been asked to actually present to the chair of the Western Australian Planning Commission these benchmarking results and the idea possibilities and benefits of doing some evaluation and monitoring and how we came up with these 15 design features from the health. And we're working with them then to see, well, how can we develop up your monitoring and evaluation framework? And I think that the goal might be to have some kind of report card delivering livable neighbourhoods each year, which to start off with will be an internal document for the Department of Planning, for them to see how well they're actually dealing with their own policy. So just in summary then, I guess where I wanted to go was that it's almost as a health researcher, planning, academic, we kind of got two markets out there for the evidence. We've got the health sector and we've got the planning sector. And much of what's been evidence that's been produced has been kind of general and associations. But you know what? That's been really important. Of course it's important to build the case. and for us to then be able to go and advocate for healthy urban environments, groups such as the Heart Foundation and conferences like this where we can bring people together and actually advocate for these environments. But if we actually want to start influencing planning, policy and practice, the types of evidence that we're now producing needs to go to the next level. It needs to be policy specific, policy relevant, and perhaps more of an evaluation type of research around different policies and the actual impacts they're having, so that we can actually get this evidence-informed policy and practice. We can highlight what bits of the policy are or aren't working and how they should be changed, which is what we've been told that the policymakers want and need. We've done, and we've seen some success. So I just want, obviously, acknowledgements. The team's far bigger than myself. A large number of staff and PhD students. And so hopefully I've just been able to share there with you some of the work that we've been doing and how we're really trying to go to the next level and see how we can actually get that into planning policy and practice. Thank you.